Welcome to Collab Conversations. This episode's guest, Lisa Machado, is a cancer patient, an advocate, a caregiver, and a journalist. Lisa knows what it's like to live with a chronic cancer, the gaps in healthcare policy, barriers to patient care, and the importance of supporting caregivers. Her experience as a patient, as well as a caregiver and advocate, have given her unique and thought-provoking insights into what it means to be a consumer of healthcare in Canada, why caregivers are essential to any healthcare team, and the challenges facing patients as they seek the best health outcomes. Lisa founded the Canadian CML Network and is the executive producer of Healthing's Advocacy and Better Health. Hi, Lisa. Welcome to Collab
Amazing.
Conversations. It's so great to have you here. I'm
Amazing.
really looking forward to our discussion today, and there are so many places I feel we can go with today's conversation. So I'm really going to have to work a little harder than normal to keeping myself focused uh, on what exactly it is I want to talk to you about today. But let's just start with like a really brief introduction to your story.
Okay. Well, first of all, thanks for having me, Sabrina. I think you're awesome. So this is such an honor for me to be included in this. So brief history. 2008, I was a financial journalist, hoping to travel the world and interview really rich people. And then I was diagnosed with a rare blood cancer called chronic myelogenous leukemia or chronic myeloid leukemia, CML for short. And it really opened my eyes to the gaps in healthcare. That was the first thing. But then the second thing also was just the cruddy way that clinicians deal with patients, when it comes to helping them with the emotional side of having cancer, but then also just developing relationships. And so that prompted me to found the Canadian CML Network, and it's a national organization, but very small. Rare disease. CML is a rare disease, and so there's only about 5,500 people in all of Canada. So I do that, and then my other job is a journalist at Post Media, the National Post, healthing.ca, which is basically a site that we've created to amplify the patient and caregiver voice.
Well, that was actually going to be one of my questions, so I'm glad that you mentioned it. So, given all your personal and your professional experience, can you share your perspective on the significance of having dedicated spaces for patient advocates to amplify their voice?
Yeah, so that's such a really good question, and I feel that we don't really value that unless you're in it. So unless you already work with an advocacy organization, that there's that. If you've experienced the healthcare system, if it's failed you in any way, if you have an illness or you're living with a health challenge, you have a child that has a health challenge. I mean, these are experiences that make you realize how important it is to have your voice heard, and how many gaps we have in the healthcare system that require people to speak up. And I think that, one of the things that we're trying to do at healthing.ca and advocacy and better health is to make these conversations a little bit easier. Because as you know, it is really, really hard to advocate for yourself, particularly if you're sick and tired, you're feeling vulnerable and helpless, and maybe you're not feeling too educated, in your disease or how to manage the healthcare system. So all of these things are really important, and everybody needs help. And so I also think, having a voice also is the way we're going to make change. If all of us sit back and don't say anything, then nothing's ever going to happen, and we're not going to be able to fix this broken healthcare system that we have right now.
Yeah, and it's exactly what you said. It's those of us who are in it understand the importance of it, but when you're not in it, like you don't see what's happening in the background. You don't understand the work that we're doing to help elevate that patient voice
Absolutely.
and to make the patient matter.
Absolutely. And you know how many times I have been, banging my head against the wall with a healthcare professional, for example, about an issue, or maybe even a policymaker. And then that person either has a diagnosis themselves or a family member diagnosed. And then they come back and they say, oh my, I had no idea. You were so right. And unfortunately, that's kind of where we've been to this point. But I'm hoping that if we really use the media to amplify voices, and we actually take the conversations that are happening within patient communities right now, but we just like blow them out and have them on a mainstream level, I think that that's probably one of the keys to success, I think.
Yeah, and I think Like, so how do we take something like healthing, where you have this platform where patients can or patient advocates can talk about the issues and patients can talk about their issues. How do we
Mhm.
use that as a catalyst for more meaningful conversations with the people who need to understand this?
Yeah, I think it's sort of a multi-level process. I think that I would really like every advocate, every patient, every caregiver, every Canadian who's had experience with the healthcare system and they have an issue that they feel needs to be fixed. I would like them to send me a note, and let's tackle it that way. So that's the first step. The second step is, and I think it's what makes us unique as a media company because we have that access to media, and politicians and policymakers, they don't like to be called by media companies, right? And so we're really using that to our advantage. So it's not just, we're not just that, cancer patient who's upset about drug access. We're that cancer patient that's upset at over drug access, but then also we've got, 120 so papers, and we're going to talk about these stories until people start listening, right? And so I think that really important. So there's one thing about telling the story. There's figuring out how to tell that story because there's also some secret, kind of magical components to a patient or caregiver story in order to get it heard. Then it's also being so public that we catch the attention of the people who are making the decisions.
Yeah, and that I think that that's the most important piece too, is catching the attention of the people who are making the decisions because they don't realize the impact of their decisions on the people that it's affecting.
It's true, and sometimes I think that they cover their heads, and they're just like crossing their fingers, saying, oh, please, I hope this
Yeah.
no one talks about this."
So, I mean, let's talk a little bit about the role of the patient advocates or the patients actively getting involved in the decision-making processes. Like,
Mhm.
how do we help shape healthcare in Canada?
It's not easy, for sure, as you know. And I just wrote a piece about burnout, actually, about advocates burning out, and I'm finding that this is a thing, where our system does not make it easy to have a voice, and if you have a voice, it's hard to feel like you have a voice, right? Because there aren't that many people listening. It feels like. So, and I've forgotten your question.
So the role of the patients and the patient groups in
Right, right,
being
right.
involved.
Yes, and so I think, we've got the usual things, right? We've got hanging out at Queen's Park, for example, doing lobbying. Uh, as a journalist, I'm really a fan of not only telling the stories, but crafting them in a way so have a digital campaign, for example, or take a full page ad out and when I say ad, I don't mean like a sponsored piece. I mean something that's coming from the patient community, that's in the paper. And I think that these are the ways that we, get the attention of policymakers, but also shift the conversation. And again, like I said earlier, is bring them out of the patient communities because we get tons of letters here at Healthing. Like the level of reader engagement is astonishing. And when we write a story about things, we'll get a letter from someone who will say, "Oh my gosh, I had no idea that this wasn't I had no idea I couldn't get cancer drug paid for and wherever," And so um, it's slow. Sometimes it feels slow, but the more we have these conversations in the mainstream, the more we get people all fired up. And that's the goal, right? Is to get people fired up.
Yeah. So I want to go in two different directions now, but I'm gonna go with so do you have any experiences or let's say success stories where
Mhm.
people have written in or a patient group has written a piece and that has actually led to some kind of transformative experience?
So I have so many,
That's
and
so good
so
to hear.
so great. And I can tell you just like the little ones are, when I go to a policy conference, for example, and then someone will say to me, "Oh man, you guys kept talking about that, drug that we couldn't get paid for, and finally it's, being approved," or something like that. But one of my absolute favorites, and I'm a little bit biased because it's a leukemia story. But a couple of years ago, we wrote a story about a woman who um, couldn't get access to a drug that she needed to live, and she was going the donor route. She needed to have a stem cell transplant, but she was Lebanese, and of course, our Canadian Blood Services has that challenge, right, with diversity. She couldn't find somebody, and so she was in hospital, probably not going to live very long. And but the story was amazing. It caught it just there was this beautiful picture of her and her husband, and it was so emotional, and it caught, so we got lots of letters. And then I actually got a call from a pharma company who had a drug that was in clinical trials for this particular the type of mutation that she had, and she got it, and we were so excited, and she got out of hospital. And so it's those things, so I quite often hear from people who say, as I'm sure you do, who say, oh, advocates are wimps, or why would you advocate, you can't get anything done anyway, like, why would you do that? And that's why we do it, because you know what, the more you talk about it, things happen. And they're, even
Mhm.
if it's little, they're not often huge like that. But even if it's little, it's, even if I consider it a victory if I have a mom call me and say, hey, you know what, we read this story, I think this is what my daughter has, right? Like, those are the things. So keep talking about things, and then eventually people start connecting the dots, and and then we become more powerful that way.
Yeah, and I did actually see the story about the Lebanese woman on the news.
Yeah.
Um, so I think so. I want to ask you about burnout before we go too far ahead,
Yes.
but I also want to ask because when you talk about like these success stories where you very clearly are helping people, and like not you personally, but all the patient advocates who are doing this work. And then
Yes.
there's mainstream media who's talking about how patient advocates are in bed with pharma.
Hate that. Yeah. I mean, so I think that's super frustrating, first of all. Um, Quite honestly, I don't know how we would do things without the support of pharma. And I mean, let's be clear, there is no patient group who is saying, hey, give me $10,000 and I'll write whatever you want, or I'll do whatever you want. There's nobody doing that. And how that I mean, I know how that dialogue started with a few smaller groups that kind of got into the thing years ago. But I don't know, no one I know, no patient advocate that I know would ever do that. And really, where else does the money come from? I mean, there's, like, one of the biggest challenges for advocates is actually making a living. Really, really hard, especially if you're on your own. How are you going to make a living? And pharma does not pay for people's salaries. They pay for projects, right? They pay for initiatives, but they don't pay for someone's salary. And even if like, and even if you could take some money off of the projects, Sarita, it's like, it's not rich, right? And so a lot of advocates end up having two jobs. Sign me up, right, to that. And so I think that, I mean, say what you want about the relationship between pharma and patient groups, but first, I don't know truly that either would exist without the other, quite honestly. I think that, and more so over the last, I don't know, I would say 5 years or so, maybe 10 years, where pharma has really, I feel they've really elevated their role in patient advocacy. I'm not sure if you would agree with that, but like, now there's all kinds of new divisions. There's like the patient access manager, and then there's the patient relation, and then there's a chief patient experience officer, which, if anyone's looking, I would love to be a chief patient officer, like, whoever, whatever job that is. But I think that they're really making an effort, to incorporate the patient voice, and they're also recognizing that it's valuable. Now, if we could just get paid for that, that would be even better. But
Yeah, like you said, patient advocacy groups, they're lean. Most of us are lean. So I mean,
yeah,
I wish I was in bed with pharma. I would definitely be making more money. But I
absolutely,
mean,
right?
I didn't mean to bring up
No,
this topic in the
I love this
conversation,
topic.
but I feel like, there's this contrast between like the really good work that people are doing and the really negative things that other people are saying. So I thought it was a really good opportunity to talk about
Agreed.
yeah, to talk about that. But speaking of being lean,
Yeah.
um You talked about burnout earlier. So
Yeah.
because these patient groups, they're lean, I mean, I that piece really resonated with me because, I'm an N of one. So
Yeah, which is incredible. Incredible. Um, and I think what makes it so tough, and actually what the driving force behind that piece was, is that a good friend of mine who's, one of the usual suspects always at the table, for any advocacy issue, we were talking and she just said, I'm done, man. Like I just can't do it anymore. And it's not just one thing, right? So it's about the money. It's about having to, go against a consultant who's getting paid thousands of dollars, who, for sure, super intelligent, whatever, MBA, whatever. But there's nothing more valuable than lived experience. And so why you put a person with lived experience up against a consultant and then pay the lived experience person parking versus a couple $1,000s, like, I don't know. So there's that. I think it's also really tough because many of us work in the areas of disease that we've had personal experience with. So that's hard. So either you have it and you're watching people die of the same disease, like that is traumatic. Or, you've had a loved one who's passed away. So, generally advocates have had some sort of, I'm going to call it trauma, but some sort of negative experience, which has driven them, to help people. So there's that. But then there's also, like, imagine every single day not feeling like you're actually accomplishing something. Like you get the no's, you get people who don't answer your calls, you work really hard and then you find out that that drug that you've worked on is not being approved, or and then that there are people that are relying on that, and I think advocates are a very special breed, exceptional people all around, who are, they're determined, they're passionate, they don't put up with a lot of crap, they don't take no for an answer generally, but we all have bad days, right? And it's hard. You cannot ask someone to be working at 150% to save the world and then at the same time say accuse them of being in bed with pharma, for example, right? Or not paying them, or just making it really difficult. Like, we're just asking to be at the table, right? Why can't we be at the table? And it's those things that, I think, contribute to that sense of burnout. And I think I said in my piece, what's most lethal to an advocate, and that's not feeling like you're doing anything, right? That you're not being effective. And so why would you continue doing it? So I think that what we should do is create, a collaborative of advocates, that where we just get together once in a while and just go through, maybe share contacts and all that, but also just really say how it is. Yeah, it's like shitty sometimes, right? It's really hard, and it's sad, and you cry and you realize how hard life is for so many people, right? And you take that on because that's what that's what you've chosen to do, and that's what makes you get out of bed in the morning. But it doesn't mean that it's easy, for sure.
yeah. So it's like a support group for the patient advocates.
Yeah, yeah. I think we need one of those. I'm gonna start working on that, Sabrina. You're gonna be the first person that I call.
I'm definitely joining that group.
Amazing.
I feel like that there are a lot of times where I would like to vent and I don't have anybody to vent to.
Oh,
So
well then, okay, sign me up.
I would take full advantage of that. But so unhealthy, you do write about like a variety of topics.
Mhm.
I mean, I think, well, I can't say the last two, but I know there are two that I have read that were so impactful for me as a patient advocate. I'm sure also for patients who are reading it, and it's about the one that you're asking, to build a healthcare system with the patients in mind, and then there was the other one on, the cost of, like, making the choice between the, like, what was better for the patient, was it the science or the economy, which, like, for me, like, speaks volumes. Can you just maybe talk about those a little bit?
So LaFontaine, who posted a comment about, some funding that the Alberta government was going to be spending on healthcare, and he's a great guy. I really like him. He's smart and he's forward thinking, and it's great that he's, now so participative, I guess, in the system. But I had to call him on the fact that in all of his questions, there was no mention of outcomes, right? And so I don't understand how you can talk about, and this happened, this, Sabrina, this happens so many times when we start talking about funding healthcare. We start talking about, oh, okay, well, we'll throw some money at the beds and we'll throw some money at screening and diagnostics. Okay, so those all sound amazing. But if you're an advocate and you're in this and you're with patients, how do you know that that's even, maybe I don't need an extra bed right now, but you know what I really need is I need access to this or whatever. And so if we're talking about, where we're going to spend money, because that was the other part of his message, is that it's not infinite. Obviously, we've got a small bucket of money. We're going to throw it over here, here, here. Let's ask those questions, like where we're going to put it. But what about what patients want, though, right? What about what caregivers need? And I don't know that we ask that all the time. And I think partly because it's just hard, right? It's hard for them to ask those questions. We're not at the table, so we don't get asked. And I don't know really if policymakers like having those conversations, because it's difficult,
Hmm.
right? And there's no answer. And so they don't like to deal with things that don't have an answer, because they like to be the ones who say, oh, I can totally, like, oh, you have problems with diagnostic machines? Okay, let's just fix them. Yay. I'm going to do that. That's amazing. But I really wish that we had people in power who would sit down with patients and just go, okay, like, just tell me like it is. What is it? What is it that we need to fix? And then just do it. Like, tear what we have down and just start from the bottom, using feedback from the people who use it. you know I had this interesting conversation a couple of months ago with, so at PMH, where I go for my medication and my checkups and stuff. They put tablets into the waiting room, like, the tablets that you write on. And the idea was to cut down on the time that the doctor spent with the patient, which I think is nuts. So anyway, but what they wanted to do is, it's an assessment form, right? And so, okay, and it asks crazy questions like, have you had to consult your spiritual care leader in the last 3 months? Have you? And then it goes into symptoms, and then it goes basically looking at your mental health. Okay, so I know, because I've experimented, that that doesn't go to the doctor, because I answered the crazy one day and nobody ever asked me about it. But the second thing was that I started hearing from patients that it was gross, like they're all dirty and spotted, and no one wants to touch them. Okay, so making a comment to one of the nurses on the floor, and she said, "Ah, we didn't even think about, like, asking anybody, that, so that, like, they're not using it. They wouldn't want to touch the tablets anyways." But so, like, that's a very small example of actually how it happens, right? Because they don't want to. If they asked, I don't know what people would say, but it would be a thing that they would have to do, right? And
Yeah.
then, and that would they would just have to do it. And so that, I don't know that policymakers and administrators in general want to really put themselves in that situation. But I don't know. I got to tell you, Sabrina, the way things are going, we're headed that way anyway. Like, things are just so broken right now, that that's where we're going to end up. But unfortunately, we're going to go through a lot of pain to get there. But I think we're headed that way.
Yeah. So there is a hospital in the UK that did that. So they were renovating their hospital or or they were building a new hospital. I can't remember exactly. It was a few years ago. And when they were building their cancer unit or the hospital in general, I can't remember, they
Mm,
asked the patients what they wanted. And so the
amazing.
cancer center actually they put on a top floor with lots of windows instead of like in a basement where you feel like you're going to a morgue.
Yes,
Yeah, so they really built the hospital with the patients, which I thought was so phenomenal. And it's
that's
like
amazing.
I can't even imagine that kind of conversation happening here, which is unfortunate because
Mhm.
our Canadian healthcare system is so well regarded across the world, but actually it's for patients here, it's terrible, which is really sad for me
It's
to say.
No, it is terrible. And it's not even like those things are, it's not brain science, right? Like, those are, so as just as a person, just think about what you would, what you would
Yeah,
like. Like, do you want to be in the basement? No, you want to be with, like, just start thinking about things that way, and I think that they should do something about the gowns, like hospital gowns, where you got to hold the back when you're, like, walking through a waiting room, like it's those sorts of things. and
yeah.
and I think you're right. I think the UK is actually a good model for so many things. that way. They really do take a more empathetic and compassionate look at care. And we could take a lot of, I think we could learn a lot of lessons from them for sure.
Yeah. Well, you also talked about how, it's really hard for the politicians to think about these things. I think, when they're looking at cancer, they're looking at numbers, they're looking at economic drivers. They're not thinking about patients. So how do we shift that conversation?
You know, as a writer, I just go back to stories all the time, and again, it's not the story of the suffering patient necessarily, although I
Mhm.
think those stories are really, really important to tell. But as you know, they're not effective, especially in the policy space. And you're reminding me actually, because I was at an event this week for rare diseases, and there's a new campaign. It's called the 1 in 12 campaign, and they had some speakers, and they had some different representatives from different policy groups or political parties, and so interesting to hear, so kind of supportive, right? The way they should be, but in the back end, like listening to people's conversations, when exactly what you said about it being a business model, I don't have an MBA, I don't think that way, but that these people are sitting at a table, they're not thinking about the child who's not going to live to be 5, they're not thinking about that. They're looking at the numbers, right? And they're just saying, okay, so this doesn't work. This is too expensive. We'd be crazy to spend this much, And unfortunately, and I get it. I get from a business perspective that money doesn't grow on trees, right? But the other side of it is that we need to spend the money on these areas, right? I'm certainly we have things we can shift, to move into healthcare. I mean, this is the most important part. Like this is life, right? And so I agree with you. I think that part of the whole issue is that, and I don't know, maybe as a politician, you're constantly balancing, you got to measure the money, but then also you don't want to be that guy. I mean, I would want to be that guy. I'd want to be the guy, who says, "Holy crap! Like she spent so much on X-ray machines or whatever, and now we're in debt." That's the kind of stuff you want to spend money on, right? But we don't. I don't feel like we have brave people. We don't have true leaders. We have people who, um, maybe want to make change. I'm going to give them that, but then also are protecting themselves, right? They want to be voted in and they want to stay there. I don't know. I think wouldn't it be more compelling to get in there for a couple of years and really tear the system up, but save lives at the same time? And then, yeah, you could just go, I don't know, do something else, be a barista at Starbucks when you're done. But I mean, that's the kind of thing, right? And you'd agree with me here, I'm sure. But advocates, that's what they have, right? They have that, I'm going to stand up in the middle of this conference and I'm just going to tell it like it is, right? Because that's what you need to do in order to make change. And unfortunately, the people who make the decisions and are in control of making significant changes, I don't know. I think they're not that brave.
Yeah, well, that actually is a really interesting comment, and I appreciate that. I think I might turn that into a campaign. Be brave. And
Oh, yeah.
but I think, it's interesting because the Canadian Cancer Society just released their report
Mm,
for 2023, and I mean, I think the numbers are pretty even. So it's like two and five Canadians. So these politicians and these decision makers, they just have to look right, look left, and somebody there that they know that they care about in their family will also be
for
affected
sure.
by cancer. So why can't you
Yeah.
be brave enough to stand up for these people?
I do not know. And I gotta tell you, I've been to so many of those Queen's Park events, where you stand outside and freeze your ass off and wait for the MPs to come out. And they do this thing where they come out, they shake your hand, they say, "Oh, I'm so sorry. I'm so
Yeah.
sorry," and but that's it. There's not like, "Why aren't we doing anything about this? Who do we need to talk to? How can I support you? Like, let's make some noise."
Hmm.
So you're so right. It blows my mind actually how y- I don't know of anyone who doesn't know of someone or themselves who's had experience with cancer, and so how could you not sign on to that? I don't know.
Yeah. So I think this is our call to action. If any decision makers or politicians are listening, this is your call to action.
I
I'm
dare
gonna let
you.
you tell them what they need to do.
Totally. I dare you. Just send me a note. I dare you to send me a
Oh,
note.
that's great. I dare you. So Lisa Machado is daring you. If you're listening, she is daring you to be brave and to tear the
Right.
healthcare system up and rebuild
Yeah,
it for patients.
absolutely. And Sabrina and I will be there.
We'll
Yeah,
support you.
totally. We'll support you.
So, I mean, just going back, to this idea of telling the personal stories. How do these personal narratives, I mean, sometimes they don't, but how do they create empathy, awareness, understanding, change? I
hmm
mean, you're working in this every day with healthing.ca, so
Yeah. I think it's hard. So it's hard, right, to tell your story, especially when obviously the more personal it is, the more it resonates. We
mm,
like to have a bit of a formula, right? So we talk a little bit about what the disease is or the health challenges and what's the worst part of it. And we want to explore the impact. So what's the impact? How did it affect your work life, your family life? Like we want to really give a full picture of a health challenge or a disease. So, we don't want to just talk about, if you have breast cancer, for example, we don't want to talk about just the impact of the treatment and all of that, because a lot of people know that, like on a high level probably, but they get it. But what they don't actually, what people generally don't talk about is stuff like, what's the impact on your kids? What,
mm,
your marriage? Like sex is so important when it comes to health issues. And we don't talk about that, right? We don't talk about, families who have they can't keep it together after a breast cancer diagnosis, for example, right? Then they end up divorcing or, those sorts of things, financial stuff, having conversations with people about your disease, which is a whole other issue. So we really try to cover all of that. And then wrap up with, how is it that you get out of bed every morning still? Like even though you've had this happen, you've had this happen, and you're not feeling well, just crappy all around. But what is it that got you on the phone with me today?
mm.
And there it's that. I think that a lot of people, it resonates with a lot of people, and it doesn't have to be. You don't have to have the same disease. You could have. It doesn't even have to be a disease. Like you just be having a bad day, and you read about what is it. Where do these people draw their strength from? And I think that that's the key, to talk about, yeah, this crappy stuff happened to me. I wish that, for example, making this up, but I wish I had this drug. I wish I didn't get a divorce. I wish I blah, blah, blah. But then this is how I'm still here though, right? I'm still talking to you. These are the things I believe should happen. And I'm here. And I think that that's the key behind telling the story. So way, way more than just talking about the impact of the disease in a medical state, but also just talking about, how it's life changing, first of all, and then also, yeah, like how is it that you're still, still standing and talking about it? Because I think that for a lot of people, that's a major challenge, but we're all doing it, right? And I think that that's what resonates with people.
Yeah. And so do you think that patient story plus the telling or the need to put the focus on what patients actually need, do you think that is why that is what makes healthing.ca so important?
Yes. Yeah, I do. And I do also because I feel that we talk about this stuff a lot. So it's not just a story, so we share on social media as well, but we're also out at conferences and talking about it. And yeah, I mean, you don't actually see that in the press a lot, right? Unless it's a really, really sad story or something, something awful has happened or it's sponsored content. Not that there's anything wrong with sponsored content. Um, but I think because we do all of our health stuff, for healthy.ca and also for, advocacy and better health, it's not sponsored, right? It comes from the patient community. But yeah, I think that, it's just making sure that, um, yeah, just making sure that we're taking advantage of the media, but also just of these voices that are out there. And quite often, we get people who don't actually aren't usually those ones who are speaking out, right? So it's the mom who's sitting in the parking lot at sick kids because she can't get in to see her kid who's having appendix surgery or whatever. The people that would never imagine themselves speaking to the press are speaking to the press, and I think that it's part of it's helping success is right there is getting those authentic stories.
And I probably should have asked this sooner, but tell me a little bit about how, like, the whole healthing.ca idea came about.
Yeah, so I started there just before it was just about to launch, just before Healthing launched, and we had started with thinking, oh, maybe are we going to be a WebMD? Are we gonna like what are we going to be in Canada? And as we started, we were covering a lot of health news, and we were lucky because COVID gave us a big boost. We were all hypochondriacs for a long time, and we did a lot of COVID and covering exactly what we had talked about before, about what it was doing to the healthcare system and the gaps that were being highlighted. But then we started hearing from patient groups, and I work in that space as well, and hearing from patient groups about things like, because first of all, a million issues, right, that just weren't being addressed, and but also that they were having troubles having their voices heard. There was that. Also super expensive to get your voices heard. Sponsor content it can be a little bit pricey, right? And groups didn't want to do that. They just wanted to deliver their message as a group, like straight from them, with nobody telling them what they needed to write or anything like that. So yeah, so then we started covering patient stories and caregiver stories, and it was so cool. People taking the time to write us letters, which and one of our editors told me that we get the most letters like in all of post media, which I think fantastic. But that's only because it's only indicative of what people value, right, and are interested in. So yeah, so we've been doing that on the healthing.ca side, and then just earlier this year, I moved over from healthing, so I'm still involved in healthing, but I'm focused on basically an advocacy content kind of support division called Advocacy and Better Health, and basically we work with advocacy groups and it could be little ones or big ones, help them also use our media partnerships to get their messages out there and to fulfill their mission and initiatives. And we've done boot camps and we run summits and we build websites, and so that's been really fun too, is participating in the growth and development of advocacy groups.
Yeah, because sponsored content is expensive, but sending out a press release is also really expensive. So it's great to be able to have that platform, and I know because I'm taking advantage of it now. Um,
Yes. Yes.
you talked about tearing up the healthcare system. I'm going to go back to this idea. If you could
Yes.
tear it up and
Mhm.
rebuild it, like, what are you doing?
Ooh, that's such a great question. So if I could do absolutely anything, like I would literally, I would tear it all down. I think that one of the biggest mistakes we're making right now is just putting band-aids on things, like we're throwing money at just different, we're just kind of feeling like, what's that saying, fixing holes, like we're plugging holes and then another hole starts. And I have a very good friend of mine who works as a consultant, and he's always telling me about the plans and strategies of administrators, and they're doing exactly that, like they're identifying some gaps, so maybe we need more beds, but it's just like the beds. But what about the other stuff? And we're having the same conversations over and over and over again. So I feel that the only way that we can actually make some change is tear it all down. So tear it all down. What does that look like? I say we get patients and caregivers together in a massive, collective. Let's just say we talk a little bit. I mean, some things are easy, right? So ER, all that stuff. It's going to come to funding though, for sure. But we actually need people to be open to that. Like we need the politicians to bring a giant wallet to this or this patient caregiver meeting, and actually talk about like what are the actionable things that we can do right now to yeah, to alleviate some of the burden. And I think that just putting the band-aids is yeah, it's just a mistake. If we just stopped everything today and then just actually go department by department, or each component of the system, and identify those gaps, and then just target those gaps, right? Um, and not do what we're doing right now. Is just just identifying the
Dominoes.
little
Yeah.
yeah, the little pieces, because there's a whole bunch of other things that are, not in that. And maybe it's a leader from every advocacy group. Imagine that, right? Who can sit down and say, yeah, this is what we need, or this is what we need, this is what we see, and then just start from the bottom. Yeah.
I
I mean,
was
that would
at
never
a
happen, right?
yeah.
But
I mean, it would be great. I
it would be
I
great.
I definitely agree with you that we don't need a healthcare reform. We need a total restructuring. Like
Hmm.
we absolutely need to start doing better for patients because whatever we have been doing hasn't been working. And I think COVID really helped us to see that this is a disaster.
Yeah, no kidding. Yeah. You were saying that you went somewhere.
Oh yeah, so I went to Colorectal Cancer Canada's clinical trials conference,
Mm-hmm.
and we saw how well other countries are doing clinical trials. 'Cause that was the
Mm-hmm.
topic of the conference. But I think it like really emphasized how well they're doing other things in I'm going to say cancer care because I think they're doing things really well in cancer care. And one of our colleagues there said he just wanted to, he actually wanted to bomb the Healthcare Act and just like tear it up, start over,
Love it.
and like fresh canvas because it is actually what we need. We need a fresh start because you were saying before it's not pretty and it's just going to get worse if we keep going down this road.
Oh, for sure. And it has, I mean, and we're not really thinking about the wider impact of that, right? And so, the more people who don't, for example, I don't know, get diagnoses too late, let's say, then they might not be around for their children, then their children have
Mhm.
mental health issues, right? It's like all of that. And it's also long-term care too. You reminded me of I went to I was doing some research on dementia care, and in the UK they do an amazing job, right? And there's this dementia village in BC. It's lovely. Like it is nothing compared to anything that we have here. And just even just sending out notes to people in Ontario to just figure out like how can we do this? We can totally make a compassionate living space for people with dementia. And it was just so interesting how many people were kind of like, oh, that's like that's a huge thing. That's expensive. That's this, that's that,
Yeah.
right? And I just think, what are you talking? How come we cannot get into the space now where, like you said, with cancer care, with anything, long-term care, mental health care, how come we're just not in that space where we can just think it's possible, right? Like,
Yeah.
because it is possible. Like we can change all of these things, right? We just need someone to put their mind to it, and then those people that have the dollars just throw their support behind it, and then you've got the we're saving money elsewhere, right? So mental health, and then people, all of this, right? Like the pressures on the healthcare system, all of that would disappear. We would save money, in other areas if we just fixed one
Yeah.
area, right?
If we
So
reduce the inefficiencies, we might
then
have more efficiency, more money to spend in
exactly.
healthcare. I mean,
Well, exactly. And
it's
it's just like if you have a leak in your roof, for example, and you're just putting tape on it, right? You're just making it more expensive, and the damage is becoming worse and worse every day, right? So, but I don't know. I mean, I don't know if you have ideas, but I try not to think ahead because I think we're screwed. But I don't know. What do you
I feel the same way. I'm
think?
really trying to focus on the little things because I feel
Yeah.
like if I look too far ahead, I'm really gonna burn out
Yeah.
and I'm not gonna be able to do it anymore.
Yeah. Agreed.
Um, but I do think that we need to shift a little bit of our focus from the cost to the value. And I think it comes back to, like what do patients actually need? And what they need is not more beds, but they need more preventative care or they need, I mean, I don't know
Or
what they
I
need,
don't know,
but
or help in their homes, for example, or
yeah,
something like that. Yeah.
exactly. I
Yeah.
really think that we need to shift the focus from the cost of everything to the value of everything.
Agreed.
But you talked about you're also an advocate. So tell us a little bit about what you're doing in the advocacy space.
Yeah, so I work in the CML space, and so thankfully here in North America, we have access to a number of treatments, so that's good. The challenge that we have is making sure that no one forgets about us, because even though it's generally well managed with medication, there are still patients who are dying. Or having to go have a stem cell transplant, or dealing with really significant side effects that affect their quality of life. So those are the conversations that I have. And then I'm also involved in some global groups, and so that is a whole other issue. Latin America, the non-Western countries are dealing with all kinds of crazy things, not being able to access medications at all, those sort, or they're just completely financially prohibitive. Um, and so yeah, so I'm involved there, and as you know, I mean, once you're involved in one disease space, it kind of becomes this little family, and so I work in other areas as well, and it's kind of the same thing, like emotional social support and drug access, and just figuring out how, if you have the gift of treatment, then you really should have a great quality of life, right? And if you
Hmm.
don't, that kind of makes me mad. So that's what I work on too.
Yeah. But that piece that you wrote actually on the miracle drug and the science versus the economy was really
Mm,
eye-opening. And you're seeing like patients are going through stem cell transplant, which costs a fortune because they
for
can't get
sure,
access to these medicines that
for
are,
sure.
yeah.
And also, it could be a deadly procedure. Like it could be life changing for you.
Yeah.
Where you like you could lose your sight, you could lose your sense of smell. Like it's not easy. And so also, so when I hear that as an actual solution, I just that's bananas. Why would you? So $250,000 to do this procedure that this person's going to be in hospital probably for a year, and then who knows what else happens after, right? And so don't fool us, right? And don't make it sound like, oh, you know what, we're just going to skip spending this money on this medication. We're just going to do this one time thing. And you think, I mean, then everyone would do it. If it was that easy,
Yeah.
sign up, you
Yeah.
know? So yeah, and I think that that's part of it too, is all this policy stuff, is that we're not always hearing the whole story, which may, and so if you're not really connected, if you just hear that, you'd be like, so why do those people want, taxpayer dollars going to this expensive medication when you could just do this? Right. And so I guess that's maybe another thing another advantage that we have at Healthing. Like we just tell it like it is, and kind of cuts through that stuff. Right.
Yeah. And I just released the podcast with Bob Bick, and we talked about the oncology relevant endpoints. And I know you're involved with that too. So,
Yes.
I mean, you're really everywhere. I don't know how you have the time to do everything.
I don't know. It's lots of coffee, Sabrina. You know how it is. I see you. Well, wherever I am, you are. So,
No, well, you're doing a lot of global stuff that I'm not doing yet. So,
well, if you're interested, I'll take you along with me because there's.
so like I guess to finish it off, what are your
Mhm.
top three concerns in cancer advocacy right now?
Ooh, okay. I would like to see us pay more attention to drug access. That's the first thing. I think that we should be done with having the conversation about like what province approves what drug. Like that's just ridiculous. I think that everybody deserves access to that. So I think there's that. I think the second thing is quality of life and side effects. I think it's super important that to push forward. It's not only just the treatment. Treatment's great, and we're also grateful for that. But I think we also need to have conversations. And this, I guess, from a clinician perspective, right? So when you're meeting your doctor, are they talking to you about how you feel about having cancer? And I mean, it's great to have great blood results, right? But then also, I think it's really important to just acknowledge how tough it is to support people and their families. So I think there's that. And I guess the third thing, I mean, I don't know. I think I'd be remiss to say not to say anything about prevention and just having the conversation about it. I think that Another thing that we do at Healthing is just educating people, because I think that a lot of times, you kind of think about it, but you don't really think about it. Um, and I think that the more educated you are about cancer, the more like you're more prone to protect yourself, I guess.
Mhm.
The preventative method, preventative, matter
Steps,
what? Steps, yes. Preventive
measures,
steps,
measures.
measures. I knew it started with an M. Yeah, preventive measures, but and also just like the education, because I think not only is there how to keep yourself healthy, but I think also people don't know what to say to people with cancer, right? And there's so many people with cancer,
That is so
and
true.
right. And so just like a little while ago, actually, I was walking on the street with my kids, and we ran into a neighbor, and he said to me, like, very seriously, and he put his arm on or his hand on my shoulder, and he said, "How are you? How are you? How are you? Like, I haven't seen you in a while. I was worried." And it was this whole very dramatic thing with my children standing there, and it just always makes me so surprised when people just don't know, they just don't know what to say, and so part of that education, I think, is that too, is incorporating people with cancer and their families as well, like into the mainstream, right? I mean, let's have a conversation about illness and disease in a way that's not exclusive, you know yeah. I think that would be my last word, maybe.
Oh, I think that's a great word to end on. I wanted to ask you if there was something else you wanted to like, is there a project you wanted to promote? How can people get in touch with you? But if you want to end it there, we can end it there.
You know what? I will actually say one thing, and maybe this is just sort of like a seed in my brain, but I think what I would like to do is start a campaign at Healthing, and we're going to call it. I think we're going to call it the Enough is Enough campaign, and we're going to get advocates, we're going to get patients and caregivers, and it's going to be a campaign that just says, you know what, we're done. Like, we're done with this. We're done with the system the way it is. We're done with people not listening to us, and we're done with waiting in ER, and we're done with our loved ones dying just because they're not getting the care that they need. And yeah, so if you're an advocate and you're listening to this, I'm going to be knocking on your door for your support. And yeah, I think that's how I'll end it then, Sabrina.
Perfect. It was such a great conversation with you, Lisa. I'm so happy we did this, and I
Me
look
too.
forward to us continuing our conversations.
Absolutely. Thanks a lot, Sabrina. I really appreciate this.
Thank you. I appreciate it too. Bye.